Fortunate enough not to need a hospital, particularly those who have been vaccinated who get infected. Scientists and doctors learned a lot over the last year on the do's and don'ts when it comes to treating non-severe COVID symptoms. The Night Team's Patty Santos talked to doctors to see what the latest research shows on what's helping those with mild COVID-19 have better outcomes.
Primary care doctors are busy taking calls from COVID-positive patients wondering what they need to do.
If it's really mild symptoms, we don't do anything. Ask them to take their Tylenol, keep hydrated, get as much rest as they can.
Dr. Saleh Jafra, who works at Medcare Associates, says his primary concern is when patients begin having respiratory problems.
How much can you do before you get short of breath? Do you get short of breath while you're talking to me? That's a big problem.
If you're homesick with COVID, you should have a pulse oximeter. If your oxygen saturation is below 94%, and that's not normal for you, then that would be a reason to go to the hospital.
Dr. Ruth Berggren of UT Health San Antonio says anyone who gets COVID and has one of a list of risk factors, such as being pregnant or having heart disease, needs to ask their doctor for a prescription for antibody therapy within the first 5 days of getting the positive test.
This can significantly reduce your risk of progression of COVID-19 disease and therefore greatly reduce your risk of needing to go to the emergency room.
The outpatient infusion therapy has FDA emergency use approval and is free in Bexar County at the Freeman Coliseum. There are also some don'ts for those who test positive. Dr. Berggren warns of the overuse of immunosuppressant drugs too early into a COVID phase.
Doctors in the community are in fact prescribing steroids and Z-Paks. You should leave the doctor visit with a referral for monoclonal antibody infusions.
And of course, if you can stay home and don't need a hospital, isolate for at least 10 days. And Tim Meyer, early on in the pandemic, we talked about how supplements like zinc, vitamin D, and also melatonin might help. Well, Dr. Berggren says the studies don't yet support the fact that these supplements help with the treatment of COVID, but she says it doesn't hurt to take them before you get COVID to make sure that your body is strong. To read more recommendads, head to casehead.com. Tim, Myra.